Hello everyone, I am Snigdha Bharadwaj, Assistant Professor, ITS College of Pharmacy. I welcome you all in my session. So, in this session, we will be discussing about pharmacokinetic parameters and their estimations. So, let us get started. So, in our earlier sessions, we have also discussed about different parameters like volume of distribution, elimination rate constant, absorption rate constant, and in this session we will be discussing about clearance as a pharmacokinetic parameters. So, the clearance is a measure of the removal of drug from the body. Basically, clearance will give you the idea about what amount of drug is getting eliminated. So, this pattern of removing drug from the system is termed as clearance. Plasma drug concentration are affected by the rate at which drug is administered, the volume in which it distributed, and its clearance. So, basically in technical terms, how we can define clearance? Plasma drug concentration, basically the drug amount in blood are affected by the rate at which drug is administration, the point where we drug administered to the patient and it is getting entered in the blood system or systemic circulation, the volume in which it is distributed, how much volume it means that we have discussed that we have several body tissues and fluids. So, once reaching to systemic circulation, it is further distributing to body tissues, and how it is getting cleared from those body tissues and systems. So, a drug clearance and the volume of distribution determine its half life. Yes, of course, it is correlated with that half life or T half of the drug. So, clearance expressed at volume by time describes the removal of drug from a volume of plasma in a given unit of time. So, basically clearance is the removal of drug from a volume of plasma in a given unit time, drug loss from the body. So, that ratio is basically a clearance ratio. So, clearance is a pharmacokinetic term, hypothetical volume of body fluids containing drug from which drug is removed or cleared completely in a specific period of time. In other words, basically we are taking data per unit of time. So, that is why it is calculating with respect to time. So, hypothetical, it is a hypothetical volume of body fluid containing drug from which drug is removed or cleared completely. That means, when we are saying that drug is first absorbed and getting distributed among body, blood plasma and body tissues and fluids, that means from there if it is getting eliminated or removed completely, that is with respect to time, that means it is taken in terms of clearance, right. So, the unit will be ml per minute either or liter per hour. Okay. So, total body clearance is the sum of individual clearances by all eliminating organs. When we discuss about total body clearance, we are saying that the drug present in blood plasma, present in different body tissues and fluid and vital organs, from all these organs and blood plasma, if it is getting cleared, that will be termed as total body clearance, right. So, body clearance basically is represented is KEVD, that is elimination rate constant, and here this is volume of distribution, K1VD, Km. So, these all are different organs we are taking, like muscles and different parts of the body, important parts. So, total, if we talk about total clearance, so it will be represented at the sum of all these different body parts and body tissues and blood plasma. So, here this will be represented as KVD. So, this is how we calculate total body clearance out of different clearance values. The most general definition of clearance is that it is a proportionality constant describing relationship between a substance rate of elimination amount per unit time at a given time and its corresponding concentration in an appropriate fluid at that time. So, when we talk about its actual definition in terms of its arithmetic means. So, the definition will be like, the most general definition of clearance is that it is a proportionality constant, proportionality constants describing the relationship between a substance rate of elimination at a given time and its corresponding concentration in appropriate fluid at that time. So, basically it is a constant which describes the how much drug is getting eliminated from the system and how much is the concentration present in the appropriate fluid at that time or in compartment, and it is basically a proportional constant. If for example 10%, 20%, 30% concentration is present of drug, so that is subjected to be eliminated, that equal percentage is subjected to be eliminated from that particular fluid, body fluids, right. So, clearance can also be defined as the hypothetical volume of blood, or we can say plasma or serum, and other biological fluids from which drug is totally and irreversibly removed per unit time. So, there are various types of explanations about clearance, but basically the amount entering to body fluid, drug amount entering to body fluid is subjected to be eliminated. So, this is how we can say the clearance is a proportionality constant. So, clearance does not indicate the amount of drug being removed, right. So, it does not indicate the amount of drug being removed, it indicates the volume of plasma or blood from which the drug is completely removed. So, basically clearance gives the value or gives the data related to that the plasma and blood volume which from which the drug is completely removed or cleared in a given period of time. Figures in the following two slides represent two ways of thinking about drug clearance. In first figure, the amount of drug, the number of dots decreases, but fills the same volume, resulting in lower concentration. So, another way of viewing the same decrease would be to calculate the volume that would be drug free if the concentration would held constant at presented in the second figure. So, basically we have this equations. So, we say that clearance in basically first representation tells you the amount of drug decreases, but fills the same volumes. Yes, so as soon as we as per the dose administered to the patient, the clearance will be done until no zero amount remains in the blood or body fluids, right. So, this basically as soon as the drug is eliminated, again it is absorbing through the system in initial stage of time, and then it will further get eliminated. So, first representation is basically depends on the amount of drug eliminated decreases and the same volume will be filled again, but at the lower concentration at the time as the time passes. Another way of viewing the same decrease would be to calculate the volume that would be drug free if concentration were held constant. If we talk about the concentration is become constant at plateau stage, when we discuss it in drug plasma concentration time profile. So, we have observed that at the peak concentration elimination will be equal to absorption. So, at that point no change in drug is seen. So, this is basically this assumption is basically depend in the second thing. So, Clt is the rate of drug elimination divided by plasma drug concentration. Basically Clt, how we can calculate it, it is equal to elimination rate and plasma drug concentration, elimination rate and plasma drug concentration. It is a ratio of elimination rate and plasma drug concentration. So, in mathematical expression can be Clt is equal to dE by dt Cp. So, the unit will be ml per minute, like elimination rate constant or elimination rate. So, it will be like dE by dt. So, dE is the amount of drug eliminated and dE by dt is rate of drug rate of elimination. So, basically it is a rate of elimination when we put dt or time with the common formula. Elimination rate dE dt Cp Clt. So, if we simplify this equation, so we will get that Cp is equal to, so first order elimination rate dE by dt K Cp Vd. So, when we put this value in the above equation, we will get Clt is equal to K Cp Vd by Cp is equal to K Vd. So, basically the elimination and volume of distribution. So, it will represent the rate of drug elimination at particular time divided the from the blood plasma. So, here once again we will have a look. Clt elimination rate, Clt is a ratio of elimination rate divided by plasma concentration of drug. The mathematical expression can be Clt dE by dt Cp and the unit will be ml per minute. Once again, if we say that elimination rate is dE by dt Cp Clt, if we put this first order elimination, so the equation will be dE by dt K Cp Vd. So, final equation of clearance, if we replace the value, so it will be K Cp Vd Cp K Vd. So, I hope you understand now. So, clearance is equal to QER. If the drug another expression is, if the drug concentration in the blood Ca, it is represent with Ca entering in is greater than the drug concentration of blood Cv leaving the organ, then some of the drug has been extracted by the organ. The ER is Ca minus Cv divided by the entering drug concentration. So, basically this is the another mathematical expression of clearance, that we are trying to say if the drug concentration in the blood, which is known as Ca, entering is greater than the drug concentration of blood leaving the organ. We are trying to say if the drug entering to a particular organ is greater than the elimination rate of that particular drug from the organ, that the sum of drug has been extracted by the organ. So, extracted by the organ, that means due to physiological conditions of particular organ, the drug elimination may be affected. So, the ER will be like is Ca minus Cv divided by entering drug concentration. So, the formula for calculating estimated drug, it will be like Ca minus Cv. Ca means the drug entering to a particular organ and Cv drug leaving to a particular organ, and Ca again the drug entering the drug concentration. So, CLH the rate of eliminated by liver and divided by plasma concentration. Basically, we can put each of these equations for calculating different clearance ratio from different organs. So, here we have written it, the clearance rate of elimination, rate of eliminated drug by liver and plasma concentration. So, you see the basic equation will be like this only, clearance the elimination rate divided by plasma concentration, but here if we talk specifically about liver clearance, the formula will be like rate of drug eliminated by liver divided by plasma concentration. In mathematical expression, it will be CLH is equal to CLT minus CLR. So, this is how you calculate the different type of clearances. So, clearance Cl. So, how we can depict it as a figure, how you can understand fundamentally like what the clearance is about. So, we see that initial concentration of any organ, we can assume it as any organ, and this is elimination over time. The dotted area represents drug, elimination over time, resulting concentration. So, sometimes it is high and sometimes like it is low. So, the concentration depends on the dose administration to a patient, and it will distributed among all the body fluids and tissues, and then the elimination will take place. So, initial concentration and elimination over time and then resulting concentration the picture shows. So, the amount of drug, the number of dot decreases, but fills the same volume resulting in lower concentration. Yes, lower concentration as the drug is subjected to elimination at any point of time. That means, again if it is refilling, the concentration gradually decreases, right, in that particular. So, volume from which drug is removed over time. So, once it is reaching to any body fluid, it is clearly subjected to elimination, and the concentration, these dots represent the concentration of drug in body fluids and the volume from which drug is removed over time. So, this is how we can depict it in figure how the clearance is taking place. Now, clearance estimation. So, basically for all linear pharmacokinetics including one compartment, clearance is calculated using this equation Cl divided by dose and AUC, area under the curve. We have discussed this pharmacokinetic parameters in our earlier sessions. So, you know that what is area under the curve? Area under the curve is this integrated area of the curve is known as AUC, right. So, here we will see that clearance is equal to dose divided by AUC. This integrated area gives all the information about drug, peak plasma concentration, minimum effective, maximum safe concentration, therapeutic index, and T max and onset of action. So, all the data you can get through this AUC. So, where AUC is the area under the concentration curve, it will be it has already been discussed. So, for one compartment pharmacokinetics clearance is calculated using this. When we depict these terms in the value. So, clearance is equal to KVD. So, this is K is your elimination rate constant and Vd is your volume of distribution, right. So, drugs can be cleared from the body by different pathways or organs including hepatic biotransformation and renal and biliary excretion. So, you must remember all those pharmacokinetic processes like absorption, distribution, metabolism and excretion. So, when drug is entering or getting absorbed from the body organ to the blood circulation, the terminology is known as absorption, whereas if it is getting distributing among all body tissues and other body fluids, then the term will be like distribution, and once it is distributed and show its effect, now the drug will be metabolized in hepatic or liver, right, and are followed by its excretion. So, basically the clearance it can be cleared from the body by different pathways, like in metabolism biotransformation may occur, or renal and biliary excretion can be used for by the body itself for its excretion, drug excretion, right. So, total body clearance of a drug is the sum of all clearances by various mechanisms. like CLT, if you calculate total body clearance, so it is CLR, renal clearance, hepatic clearance and other clearance. So, it is a combination of total body clearance is the basically sum of different kind of clearances. So, CLT, CLR, CLH is total renal and hepatic clearances. Elimination rate. The elimination rate at any time can be calculating using elimination K into XT. XT represent drug amount at particular time, or elimination rate is equal to CLCT. So, X sometimes is the amount of drug, whereas it is represented in terms of concentration. So, where XT is the amount of drug in the body at time and CT is the concentration of drug at time t, right. So, this is how we can calculate. Rather than describing in terms of the amount of drug removed per unit time, clearance is described as the volume of plasma cleared of drug per unit time. Volume of plasma cleared of drug per unit time. So, we do not take the amount, basically we are taking the concentration of drug removing from the plasma at particular time. So, here you see that it is 100 mg drug we assumes, and in the central compartment or in blood it is 100 mg per liter. Now, liter per hour and the total volume is 10 liters. So, if it is a case, then how much drug you have added to the system or administered. So, in 100 mg you have given, that means the total volume of the body fluid is 10 liter you assume, then the concentration will be 100 mg per liter. 100 mg per liter 10 will be removed, and the drug concentration will be considered as 100 mg per liter. So, this is how you calculate concentrations and the amount of drug eliminated from the systems. So, but body is not a beaker, multiple systems are involved, say drug you are giving IV through IV injections. So, volume of distribution different. So, this is a body, and these are different organs. So, through kidney and liver, so elimination will be different. Through kidney it will be eliminated in urine, and in liver either in bile or as metabolites. So, basically the basic assumption can be done through this, but the body has different biological compartments, multiple systems. So, drug elimination or clearance may be calculated based on different considering different parameters like kidney in terms of urine. So, if you want to calculate the clearance, so you have to take the renal clearance. So, that is why we took all these clearance, renal, hepatic and others. So that we can get overall value for clearance. Relationship of clearance to elimination, T half and volume of distribution. So, CLT basically it is a KVD. So, K is equal to point, it can also be represented as K 0.693 by T half, right. Either you can present as like CLT KVD, this is the basic equation. Therefore, by substitution CLT is equal to 0.693 VD. So, K value here is this. If we substitute this equation by putting this instead of K, so the equation will be CLT 0.693 into VD divided by T half. T half, now by simplification is this equation, T half is equal to 0.693 VD by CLT and inversely related to CLT. So, T half also dependent on volume of distribution, and K and T half are dependent on both CLT and volume of distribution. So, this is how we can calculate the relationship of clearance with volume of distribution and T half. These are references. I hope you understand the basic concepts of clearance. So, in our upcoming sessions, we will be discussing with the same topic. Till then, take care, stay safe. Thank you.